The prosthesis is delivered in its firmly closed triangular box. To safely unpack the prosthesis and reduce the risk of it bouncing off the triangular box due to static charge, we recommend to insert some sterile liquid into the recess of the triangular box. It can be inserted with a syringe through the lid, prior to opening the triangular box or after opening the lid. Now the prosthesis can be removed from the triangular box. We recommend using a suction tip or a pair of tweezers. The CliP Dresden has longer prongs and shorter prongs. The two shorter prongs are designed to allow space for the stapedius tendon, which can safely be placed in between the prongs. A marker on the head plate indicates the side with the two shorter prongs that facilitates orientation above the stapedius tendon. To clip the prosthesis onto the stapes, make sure the marker is located in the correct position above the stapedius tendon. The prosthesis must be placed straight above the stapes head in order to avoid bending the prongs during the clipping process. Then use a needle to give the prosthesis a gentle push onto the stapes head and make sure it is placed securely. Kurz, middle ear intelligence for more than 30 years.